3 decades ago, we used to do all surgeries open, and surgeons started to look at a way to minimize the incisions. This one gives a tactile feedback. So with time, there's more and more enhancement so that you can do complex surgeries in the difficult parts of the body, similar to open, with tiny little incisions.
The smaller the incisions, the less likelihood for hernias, for example. There's less pain, there's less blood loss. Removing the rectum and the tissues around it is important in treating a rectal cancer, but not damaging these other structures is critical. In addition, the more precise we can be, the less likelihood there is that one will wind up with a colostomy bag.
What did robotics bring for us? One is that when we operate, we are sitting down. You'll see right now on the console, it's very good position for the surgeons to sit down and look where you're operating. Second is that the vision becomes three-dimensional.
The robot has actual wrists as opposed to laparoscopy, which is just two straight instruments. And because of the wristed instruments, we're much more specific, our dexterity is much better.
There's far less bleeding, far shorter hospital stay, far faster recovery. So it's not even comparable to open surgery. Clear benefits.
There are actual studies now. We have randomized control trials that are demonstrating that the results of robotic surgery are superior to that of laparoscopy and open surgery.
Normally when you do a bypass, you have to open the chest, stop the heart, so the heart doesn't move, and then you can do a bypass. With the new technologies, you don't have to open the chest, you put a robot and the heart is still beating, you don't have to stop it.
The robot was actually first utilized primarily in urologic surgery, especially radical prostatectomy. So actually I have been using the robot for 20 years. You also need an excellent team around you, and we have a dedicated robotics team, and that provides a lot of the continuity that you need to make sure that the surgery is a successful surgery.
This is an ion robotic bronchoscopy system. With this device, I'm able to put patients to sleep, biopsy the nodule, and the risk of pneumothorax is really only about 1 to 2%. So there are a lot fewer complications. So what this device essentially is a catheter delivery system. What it's allowing me to do is take the needle, in my case, to the tumor and biopsy it. But in the future, what it's going to do is take a probe to the tumor where it can either be burned or freezed, or chemotherapy can be injected right in that spot.
Even with open, it's not easy to see. With the robot, with the big magnification, 3 dimensions, you can go through nooks and corners and see things much better. So quality of surgery can be better, you can operate better, and the recovery is better. So it's a game changer.